Welcome to my podcast. Today I'm going to talk about one form of childhood problem that you can face in a clinical setting. So after introduce yourself, as always, I agree, double check the patient name, date of birth. The woman might have her child who she notes that he's shy, trying to avoid any situation whereby to talk, and it's causing him like bully, being mocked in school. So the topic I'm talking about is stuttering. As we know, stuttering has multifactorial issues, which involve that there is like element of atypical neural speech processing. It can happen and start suddenly, unexpectedly, with the median age of 31 months. So it's that we are talking like more than 3 years. And the prevalence, it's like 2%, and 10% of population at certain stage in their lifetime from any culture or any language can be affected. It has been said that early intervention, early childhood is the best clinical option because there is the advantage of neuroplasticity, and this which has been seen in certain clinical trials. However, if it has been ignored, as the age increases, it will become stubborn and tractable, and it's going to affect, of course, the quality of life like anyone with chronic illness. And it's when I say the quality of life impairment, it's like educational, occupational, anything has to do with speech related, because they're going to have this kind of social phobia or anxiety, which of course will trigger the stuttering more. And those affected persons, they will always try to find ways to avoid this. And the only program with the clinical trial evidence for early childhood intervention was called LITCOM, and it proved that early intervention could have an impact, a positive one, rather than leaving it. However, there is, of course, as we all know, no effective pharmacological treatment that we can offer. So stuttering is basically about speech condition whereby the verbal communication is interrupted, as we all know. So it can be like words or syllables repeated, or the sound is prolonged with a complete blockage of speech production. So the people who stutter, they will have this kind of physical tension and prefer sometimes nonverbal features in order to avoid this. And it says that they have also certain uncontrollable movement like tick-like movement of the face or the head or the torso. And who suffer with stuttering, the issue is always difficult with the production of speech. So there's different ways of processing of producing speech. So they have issue of production and processing the speech, and it can affect any, as I say, culture or any language. And it's more predominant in male comparing to female. It has been stated that it's associated with several factors, and the brain imaging shows that there is a atypical neural speech processing that contribute to stuttering, that the cortical and subcortical network, which involved in planning the production of the speech, has been affected and implicated, which lead to underdevelopment of connectivity in the brain region, which will affect, of course, the planning and production of the speech. It can be as well genetic, and around 70% have family history of stuttering, so it can run in the family. And also it can be inheritance with polygenetic causation. As I say, it can be seen or manifest after the age of 3 and can start unexpectedly overnight, as it's been said, and especially will be manifested when the child tries to use a longer or complex sentences, and and it can be, as I say, either gradual or overnight manifestation. It's been stated that early intervention is better than later on because of the element of neural plasticity, which nowadays it's been stated about any current condition to involve the psychological approach, like CBT and those kind of things. And so it's about trying to allocate a speech therapist or pathologist to review the situation of the child in terms of the assessment or management, and especially preschooling treatment can resolve successfully stuttering or reduce its severity dramatically, and children can recover. However, it's unpredictable as well, as I mentioned, and it just suggested that early intervention is better than later on. And the Cochrane review found that the program, as I mentioned, LEDCOM, was the best or the only childhood treatment with superior overall treatment control. So when we talk about, for instance, the quality of life and how we're going to impact it, because it's long-term issue, if left, it will cause to long-term quality of life impact, whether it's economically, whether it's educationally, on those kind of things. So the child will be really frustrated and will avoid talking and will withdraw from any social activity or any play, because when they are in a stressful situation, the child will stutter more, and this will cause him or cause her anxiety, and while talking or reading in front of their class pair, they will stutter more and they can't conceal it, so they will try to avoid schooling by any ways in order not to be teased or bullied by their class pair. Because, of course, bullying and teasing will associate with negative impact in their mental health and emotional and physical well-being, so they will create any trouble in order not to go to school and avoid those kind of situations. Also, it has been documented that they don't do well in secondary school or higher study. They will just go for the less, whereby there is no element of talking, just even for job-wise. It's always anything with less talking or communication with people to avoid the hustle of using speech or communicate with others. And this, of course, will cause social anxiety, mental health problem, and other condition related. And also, it has been stated that the comorbidities of the mental health condition, of course, it's something that we don't need to ignore, because it's too much high, especially if left to adulthood. It will be increasing way more than when it was around the childhood. So the stuttering is, if it's persistent, And as we know, the more you age, the cortical neuroplasticity will decrease, and the stuttering become more obvious and less responsive, of course, to treatment or any way of intervention. And of course, it has been stated the persistent stuttering treatments mostly focusing on controlling and managing stuttering, so it's typically involving to use like fluency enhancing technique when talking, which will help with speech restructuring. And this has been with strongest evidence in the clinical trials, where speech restructuring can help adolescent to control stuttering. And another form, as I mentioned early on, psychological approach, which is CBT, has shown best evidence in treating anxiety around stuttering. So in that regard, we need to tailor CBT for each individual in order to improve their overall quality of life. And of course, we know the severity can be varied. So some people might have mild stuttering, or some they have severe, can be triggered with different situations, like talking in front of people, or an authority, or on the phone. It becomes more severe if the patient is tired, or anxious, stressed, or feeling unwell, and certain activity as well. However, they stated that there is certain activity can improve stuttering because there is no element of too much talking or communicating. It's been stated like singing, acting. So in this kind of situation, the word or the way how it's been pronounced is quite altered. The vowels and words would be extended, and the speech rate is much reduced, so it's not noticeable. And of course, acting or performing is a different situation whereby you're not going to talk at all, just performing. So, so that's another thing that which can help in those situations. As I mentioned, there is no treatment for this condition. Well, I don't know when they say no treatment, what element of treatment they're gonna use. So it's behavioral mostly, as I mentioned, and it needs to be early on because of the advantage of the neuroplasticity. And they say there's good evidence also in the support of telehealth intervention, which can help in younger children. And family needs to know how to communicate or how to deal with this. So the speech therapist or the speech pathologist need to, after assessing and management, need to agree with the family what approach and what ways can be done in order to improve their ways and minimize the level of stuttering. Also, there's some automated online speech and anxiety treatment can be used at various stages of the development, as it's been stated, in order to minimize the situation or help the sufferer in order to not affect their well-being or their life. So by this, I hope that I covered some of the stuff around stuttering and how we can approach it or address it. It's kind of difficult situation, but it needs to be someone who's understanding and how to tackle it early on in order to avoid the long-term impact and its negative implication. Thank you.